I do think it's a little bit gimmicky in that what's inside the IV drips is Hey everyone, hope you're doing well out there. So in this video I just want to talk about Joe Rogan's treatments for COVID-19 that he posted in a recent video, and I wanted to just share my thoughts as a critical care pharmacist and what I think about them. Before we get into the actual video, if you're new to the channel, welcome to Traumacistrx. My name is Freddie and I'm a critical care pharmacist, and on this channel my focus is on making healthcare information easier for you to understand so that way you can make more informed decisions. If you like this video, please consider liking and subscribing. Also hit the notification bell and also check the description below because I do have links that could help you with your own research as well as ways to support my channel. So let's get into the video now by looking at Joe Rogan's actual post.
Hello friends. So I got back from the road Saturday night feeling very weary. I had a headache and I just felt run down, and just to be cautious I separated from my family, slept in a different part of the house, and throughout the night I got fevers and sweats and I knew what was going on. So I got up in the morning, got tested, and turns out I got COVID. So we immediately threw the kitchen sink at it, all kinds of meds, monoclonal antibodies, Ivermectin, Z-Pak, Prednisone, everything. And I also got an NAD drip and a vitamin drip, and I did that 3 days in a row. And so here we are on Wednesday, and I feel great. I really only had one bad day. Sunday sucked, but Monday was better. Tuesday felt better than Monday, and today I feel good.
So monoclonal antibodies were one of the first things that Joe Rogan talked about. Monoclonal antibodies such as Regeneron are something we do use in the healthcare setting, mainly to treat patients who meet a certain criteria, such as being aged 12 years and older, having a mild to moderate symptom or infection of COVID-19, and also meet the criteria for being a high-risk individual who could potentially progress to a more severe version of COVID-19 infection, such as those who are immunocompromised, maybe with more comorbidities, or even other diseases that fit into the category, and I'll list it here. So just for a review, if you haven't seen any of my previous videos, monoclonal antibodies, in the case Regeneron, work similarly to those antibodies that would happen from either a vaccine-induced immunity or from natural infection, where they target the COVID-19 infection and inactivate the virus so that way the virus cannot spread and cause more severe infection in your body. So in a typical treatment with Regeneron, we would find patients in the ED, ask them questions, see if they meet the certain criteria, have them get the Regeneron in the emergency department and monitor for side effects such as anaphylaxis. And then if they don't have any symptoms, we would send them on their way home without any additional treatments, because we would expect that because they have a mild to moderate infection, they wouldn't need further treatments and patients would likely recover in a few days, kind of how Joe Rogan has mentioned his course of infection was like maybe 4 or 5 days as far as he was, like when he was recording. So the second medication that Joe Rogan mentioned was Ivermectin. So Ivermectin has gained a lot of popularity, mainly from social media and people posting their success or their experiences with, Ivermectin horse paste and things like that. So if you don't know what Ivermectin is an anti-parasitic medication usually used to treat parasitic worm diseases from other countries, as well as lice and also some skin conditions as well. From a pharmacist perspective, I'm actually kind of curious, one, how Joe Rogan was able to get Ivermectin. Did he use like the typical tablets used in other sorts of diseases? Did he use the horse paste, which I hope he didn't? And how he was able to get a prescription in the first place, because across the board, there hasn't really been any good data to show that Ivermectin should be used as a COVID-19 treatment. I know that there's some ongoing trials right now as far as looking at it in the principal trial, as well as some other meta-analyses, but so far the current data is that we should not be using Ivermectin as a treatment for COVID-19. If you are someone who has taken Ivermectin or is considering it or knows somebody, I highly suggest you shouldn't, because you're more likely to overdose on the medication, especially if you use the horse paste version, which contains about 1,000 times or even 100 times more the normal typical human dose, and potentially you could overdose and cause severe side effects such as diarrhea, constipation, abdominal pain. You could cause severe headaches, you could cause seizures. I could go on and on with all the side effects, and I'll probably try to list some of them here. You know, there's so many side effects to ivermectin, especially at higher doses. It's not really worth it to try this medication because there hasn't really been any data, and there's a lot better treatments out there. If you want to learn more information, I suggest you either contact Poison Control, or if you're someone who accidentally ingested ivermectin or wanted to try it for some other reason of your own, highly suggest talking to Poison Control because, again, there's so many side effects. And if you don't know the number, I'll put it right here, but the number is 1-800-222-1222. And again, I highly suggest not using ivermectin, and I'll do another video about it later. So the next medication that Joe Rogan does talk about is a Z-Pak. So if you're not familiar, Z-Pak is another form of azithromycin. It's the brand name. So azithromycin is an antibiotic. It's used to treat, community-acquired pneumonia. Based on Joe Rogan's video, I'm not quite sure why the physician or whoever prescribed azithromycin to him. Maybe he could have had an underlying co-infection with bacterial pneumonia, but based on what was in the video, I do not want to speculate, or I do not know. In general, in the hospital setting or in the ICU, we try to avoid giving unnecessary medications. Usually my approach is the less is more sort of treatment, and if patients do not present with a bacterial pneumonia and instead have a viral pneumonia, we do not want to treat with antibiotics because that can cause unwanted side effects such as diarrhea. It can also, specifically with azithromycin, cause QT prolongation or other arrhythmias, which would be other complications to add to the patient's infection. We also don't want to use other medications that we don't need to because it can cause drug-drug interactions and also drug-lab interactions such as abnormal LFTs. And I don't know why he's on azithromycin. Maybe was a community-acquired pneumonia sort of prophylaxis. In general, wouldn't want to see a viral infection being treated with an antibiotic infection. So if you do have COVID-19, please do not ask your physicians or the pharmacist for antibiotics because that is not the right way to treat these infections. You'd end up maybe potentially causing induced bacterial resistance, which would be not good. So the next medication that Joe Rogan talks about that he's taken is prednisone. So prednisone is an FDA-approved medication. We do have data on its effectiveness in COVID-19, and typically in the hospital we use prednisone's cousin dexamethasone or Decadron. And what we've seen in the recovery trial is that patients who are on Decadron had a decreased mortality, which means a decreased risk of dying from COVID-19 when they were treated with a short course of Decadron inpatient. So as far as using prednisone, it's not a bad idea, and I think that there's more data coming out that patients who are not hospitalized may be discharged from the ED on a short course steroid therapy to help prevent what we call an inflammatory response such as cytokine storm, which can happen with COVID-19. And when cytokine storms do happen, what can happen is that patients can go into multi-system organ failure, or because COVID-19 is a respiratory disease that can cause inflammation in the lungs, what can happen is lung damage because your inflammatory system is overreacting. So being on a steroid is appropriate. It's something we do in the ICU. We do have patients on steroids to help combat the inflammation. So the last thing that Joe Rogan mentioned was NAD IV drips and vitamins. So if you're not familiar with NAD stands for nicotinamide adenine dinucleotide. So NAD is used for multiple processes in the body, such as metabolism, synthesis of proteins, as well as other cellular processes and even cellular regeneration. What I found interesting when doing a little bit of research is some of the claims that were made with NAD drips. This is not something that is used in the healthcare field, and if it was something that was effective, we'd probably use it on our ICU patients, which are the sickest patients I see, but we don't really do that in the hospital, so I don't think it's a great therapy. But some of the interesting claims I found was that NAD IV drips were used to help patients recovering from addiction or alcoholism, anti-aging or reversing aging or extending lifespan. What else did I find? Helping with metabolism and weight loss. I don't really think are true, and after searching through some of the databases, there isn't really good information to suggest that NAD therapy would be good for COVID-19 treatment. I do think it's a little bit gimmicky in that what's inside the IV drips is a portion of NAD and also vitamins such as vitamin C, B12, which are things you can get from your normal diet, and maybe a once a day daily vitamin. So you don't have to spend a lot of money, because I did see that these drips are like $1,000 per treatment or something like that. So I think it's a little gimmicky, and from the sciencey perspective and from a pharmacist, looking at the half-life of NAD anyways, the half-life is 1 to 2 hours, and that's coincides with what our body would naturally do with any proteins. They don't last that long. If you think about it, like if you're getting an NAD drip, it'd probably take 30 minutes to an hour to infuse it. By the time you're out of the clinic, the NAD is gone. So do you really get any sort of benefit? I'm not quite sure. There's not much data out there, but I wouldn't recommend it, and it's really expensive. And then really quick, as far as vitamins, like I mentioned, having a healthy lifestyle does help with improving immunity, such as healthy, balanced diet, exercise, maybe a daily vitamin if you really want to, or if you think you're deficient in some sort of vitamins. I wouldn't go overboard with vitamins though, because you can actually cause electrolyte imbalances, which can then lead to further complications, especially if you have renal disease, and then you'll have to go to the hospital anyways. So wouldn't want to go overboard on that. Again, these aren't really direct therapies for COVID-19 treatment, and they haven't been studied that way. And in the ICU, even if we've given patients vitamin D, vitamin C, we haven't seen really much improvement aside from the therapies such as steroids and other things like that. So these are my thoughts on Joe Rogan's video and his experience in treatment with COVID-19. I don't want to downplay the fact that he did get COVID-19, and I hope he recovers speedily, because I think that anybody with a COVID-19 infection is at risk for more long-term side effects and complications that we don't know about. So I'm glad that he's doing better based on his video. But I also want to emphasize that we do have actual treatments and preventative things such as the vaccines that have been studied and have shown that they're safe and effective, that supersede things like Ivermectin, which haven't been studied specifically for COVID-19. So we do have good treatments out there that are working to help patients with COVID-19 recover as best as possible. And I encourage you to, talk to your doctor about what's appropriate for you. I also encourage you to do a little bit of research on your own before willy-nilly buying Ivermectin or things like that from your, pet store, because it definitely can be dangerous. If someone were to overdose or get poisoned by ivermectin or any other claimed cure, that could be a bed that could be used for an ICU patient, such as someone with a heart attack, COVID-19 infection, or anything else. And that's something that we do not want to overwhelm our friends and nurses and colleagues in the hospitals as well. So if you did enjoy this video or learn something new, please consider smashing the like button and subscribe button below. Also the notification bell so you can know when my next video is up. Check out the description below for more information and support the channel. And yeah, I'll see you in the next video. Take care.